We will begin with the cervical spine and intervertebral disc anatomy. You are viewing a human male's spinal column, the cervical, thoracic, lumbar, and the pelvic region. We will now focus our attention to the 7 cervical vertebrae. Notice the dexterity of the neck. The spinous process of a vertebra is directed backward and downward from the junction of the lamina, and serves for the attachment of muscles and ligaments. The spinal cord passes through the vertebral bones and is protected by a series of connective tissue. A vertebra is an individual bone in the vertebral column that encases and protects the spinal cord. Intervertebral discs lie between adjacent vertebrae in the spine. Each disc forms a cartilaginous joint to allow slight movement of the vertebra, and acts as a ligament to hold the vertebrae together. Nucleus pulposus is the jelly-like substance in the middle of the spinal disc. It functions to distribute hydraulic pressure in all directions within each disc, under compressive loads. Each intervertebral fibrocartilage is composed at its circumference of lamina, of fibrous tissue, and fibrocartilage, forming the annulus fibrosus. Now we can see the spinal cord, which consists of gray matter and white matter. The small hole in the center of the spinal cord is the central canal. The dura mater is the tough, fibrous membrane forming the outermost of the 3 coverings of the spinal cord. Branching off from the spinal cord is the spinal root and the spinal nerve.
The spinal cord has 2 important functions. The gray matter in the center of the spinal cord acts as the cells that provide the decision-making capability. The white matter surrounding the gray cells is formed of spinal tracts that carry information from the brain down to the body, or from the body back up to the brain. The spinal cord passes through the vertebral bones and is protected by a series of connective tissues and fluid-filled spaces. The epidural space is a fat-filled area that provides cushioning. This is the site of anesthesia injection. The dura mater is a very tough connective tissue and provides a great deal of physical protection. The cerebrospinal fluid flows through the arachnoid space in a small central canal within the spinal cord. The cerebrospinal fluid is important for cushioning and also for providing transport of oxygen and nutrients.
This is the anterior side of the neck. The surgeon will make an incision here to access the front of the spinal column. A burst fracture is a very serious form of compression fracture. If the vertebral body is crushed in all directions, it is called a burst fracture. In this type of fracture, the bone is shattered from the injury. The vertebral body explodes into several fragments. Bone fragments may pierce the spinal cord. Burst fractures often result in a serious spinal cord injury. To repair a burst fracture, the surgeon will first remove the intervertebral discs, usually with an instrument called a curette. A curette is a surgical instrument designed for scraping The tip of the curette is a small scoop, hook, or gouge. This procedure is called a discectomy. The surgeon must then meticulously remove as many bone fragments of the shattered bone as possible. After as many fragments that can be removed, the spinal cord will now be exposed. This procedure is called a vertebrectomy. Bone grafting is a surgical procedure that replaces missing bone with material from the patient's own body. This is called an autograft. Bone grafting is used to repair bone fractures that are extremely complex, pose a significant health risk to the patient, or fail to heal properly. This patient's graft was taken from his hip bone. The surgeon will use a metal plate and screws in order to stabilize the bone graft until the bones are fused together. Patients who undergo surgery or sustain an injury to their cervical vertebrae must often wear a halo vest to immobilize their head and neck. The halo vest has three main parts. The metal halo ring that fits around your head and is secured to the skull by 4 metal pins. The lined vest that suspends the weight of the apparatus around the trunk of your body. And the metal bars that connect the halo ring to the body vest. Yes, in appearance, it could be mistaken as a medieval torture device.
Well, old chap, it appears we have detected that the newly grafted bone has become infected. We will need to perform surgery immediately to remove that infected bone. This is called osteomyelitis.
Osteomyelitis is the medical term for an infection in a bone. It will require surgery to remove parts of the bone that have died, followed by strong antibiotics, often delivered intravenously, typically for at least 6 to 8 weeks.
We speculate that one of the screws used in the initial surgery to stabilize the bone graft became loose and wore a hole in your esophagus. Normal bacteria latent germs present in everyone's oral secretions were infiltrating the perforation of the esophagus. This was the probable source of the infection. We must remove the diseased bone and tissue. This procedure is called debridement. We will remove as much of the diseased bone as possible, taking a small margin of healthy bone to ensure that all the infected areas have been removed. Surrounding tissue that shows signs of infection also may be removed. Well, Yank, we believe we have removed all of the diseased bone. The bone graft in your neck was completely infected and had the consistency of a wet sponge. Our next approach, we will be giving you strong antibiotics for 8 weeks. Unfortunately, my friend, this will not allow you to eat or drink anything for the entire 8 weeks, even including ice chips. We will let the perforation of your esophagus to heal naturally, and we are hopeful we can attempt another bone graft in 8 weeks.